One of the main reasons I started doing some fasting a few years ago is because I've heard like a lot of anecdotes of people saying I'm able to focus better when I'm fasted, like when I'm not eating or I'm not focused on food. So that's why I started doing it. And I noticed that effect. And people have said that it does increase BDNF when you're doing some intermittent fasting or long-term fasting. So what I'm curious about is on the side of the brain, does implementing some intermittent fasting actually benefit your ability to focus, or is that more of some woo-woo stuff about
Yeah,
fasting?
no, it's very accurate. I know what you're talking about. So basically, the way this seems to work is that first of all, by the way, ketogenic diets were developed for epileptic patients at Johns Hopkins University originally. You know that, right?
Mm-hmm.
So what it does is it seems to be the ketogenic diets either reduce glutamatergic activity, which is the main excitatory neurotransmitter in the nervous system, or they increase GABAergic activity. So they seem to make people a bit calmer. The other thing that people have noticed, and really where I paid attention to this was, you know how, Mark, there's these rodent studies about caloric restriction and fasting that David Sinclair and so on talk about a lot. Many people don't know that depending on the rodent strain, if you give the rodent a low protein ketogenic diet, they can live sometimes as long as caloric restriction. But the interesting difference is that they have the best integrity of their brain later in life. So it seems to be that either insulin resistance or glucose or sugar, in fact, could be damaging to the brain. We know sugar is, because, by the way, dopamine is a neurotoxin. If you cause too much dopamine release acutely, it's excitatory, cells downregulate in response to it. But if they don't, they die. So, for example, if you're eating a lot of sugar all day, you may experience some kind of excitotoxicity. But I really think it's just this insulin resistance and high glucose levels in the brain causing detriment over time. So what I think is happening with you probably is what happens to me. So I do time-restricted eating. I still eat salads and stuff like that. So I'm not eating a ketogenic diet. But because I'm only eating for about 8 hours a day, by the next morning, I have some kind of fat adaptation coming along. And my brain is much clearer thinking. I would advise the audience, if anybody in the audience tries a real ketogenic diet that's not high in like really toxic saturated fats, it's not like all butter, for a couple of weeks, you'll notice your brain thinks clearer. You can think from the top down better. Your short-term memory is better. You notice that too?
Mm-hmm.
Exactly. So that's one of the best. It's one of the best ways without pharmacology and supplements to improve your concentration. So if somebody, for example, fasted 5 days every month, but throughout the month was eating a lot of protein and that kind of stuff, which is what I did for a year, by the way. I fasted 5 days for a whole year, originally 7 days, and then I was doing 5 days every month. So when you do that, though, you end up losing so much body fat, you have to eat more the rest of the month. Mm-hmm. I think that's fine. I think you get that 2-week reduction and that 2-week growth stimulus. I think that some kind of cyclicality is the key.
And do you think that the fast does it need to be a consecutive 5 days, or can you do like 24-hour fast? The norm, like, could you do that 5 days throughout the month?
So there's a couple of common factors that happen in blood tests after about the 3rd day. They don't happen in the 2nd day. The first 2 days you tend to have high ghrelin signaling, which is that hunger hormone, which also the reason why you have high growth hormone signaling, why it's difficult to sleep and so on. The 3rd day, you tend to adapt to it. And of course, by the way, the more times you do fast, the easier it becomes. At the end of my year, I was doing 5-day fast. I was barely feeling hungry until the 4th or 5th day. But so the 3rd day, something happens. If you go do your blood test on the 3rd day, you'll find your uric acid is high, your testosterone is low, your triglycerides are low. There's a repetitive pattern. My goal would be to get that in the blood test and then keep it for 2 days as a minimal effect. I used to fast for a week, but I found out this seemed inefficient. Most of what happened in the first 3 days or so. 1 day fast can be useful in the sense that they could increase insulin sensitivity throughout but I don't think you're going to get in that phase of regeneration that Walter Longo has so many studies on in 2 days.
Could you speed up the effect of a 5-day fast with high levels of cardiovascular exercise while you're fasting? Let's say you're doing weight training and cardiovascular exercise. Could you get the effect of a 5-day fast in a 3-day period or a 2-day period if you're doing that?
I'm quite certain you can. And people have been now experimenting on my channel with using things like thyroid medication, because the thyroid hormone declines during the fast and is one of the reasons that you expend less energy. So the fast, a lot of it seems to have to do with the nutrient sensing issue and then cellular stress. If you could exaggerate that stress a little bit, it may speed up the whole process. So using something like thyroid hormone or doing more cardiovascular exercise, which I was doing on my fast, I would do a lot of, and it would speed it up tremendously. You could notice, especially like you get rid of your glycogen stores faster. So you enter into that phase faster. Usually it takes a day to 2 days to get rid of those glycogen stores, the excess ones in the liver. But this can happen very fast if you're doing more cardiovascular exercise, or if you enter the diet in a ketogenic diet, or if you use thyroid hormone, or if you use clenbuterol, or so on.
Yeah, I remember years ago when people were talking about the fastest way to get into like ketosis, and one of the fastest ways was just to not eat, walk a lot. Like there was some people that like literally kind of walked all day, and the other thing they did is they didn't drink water, and it somehow kind of expedited the whole entire process, which is, I don't know, I find it pretty fascinating. I personally have never done that protocol because I'm like, it doesn't seem like a great idea. I like to train as well. So, but I have done fasts from water before, along with fasting away from food. I've done that combination before, and it actually feels really powerful. Have you ever messed around with that?
Well, because I grew up in a Muslim country in Dubai, we fast for 30 days for a few hours every day from water and food. So I was experienced with that from childhood. I never noticed any benefit from fasting from water personally. And I know that there are people that believe that fasting from water may be beneficial. I've never seen any academic evidence of this. What I'd be concerned about is that the most harmful thing for the kidneys is acute dehydration. Mm-hmm. It's much worse than hypertension. It's worse than, anything except maybe injecting yourself with a poison IV. It's very damaging to the kidneys. So my concern would be that there's some damage there. And I don't know, maybe there is some benefit. Maybe we have some water sensing pathway we don't know about. But we don't know about it for sure.
In the these types of fasts that we were talking about, these very specific fasts to help with like a cyclical type of diet, would using electrolytes during that fast, that wouldn't take away from anything, right? That would just help with hydration. Let's say that you had an electrolytes, sodium, magnesium, potassium. Would that be beneficial during, or would that take away from anything we're trying to do?
You wouldn't want to use potassium, but you could use magnesium and sodium. And in fact, I do, and I'll tell you how I usually do it. So I usually supplement with maybe like 500 elemental milligrams of magnesium, which could be much higher than that depending on the what it's attached to. So there's a variety of kinds of magnesium. Magnesium orotate, for example, is an inferior one. Citrate is all right. I use sometimes L-threonate or bisglycinate. Bisglycinate is the most absorbable form in studies, but they've never compared bisglycinate to L-threonate, which seems to get into the brain better.
Hey guys, if you like this clip, go ahead and comment down below and let us know what you liked about it. All right, share this with a friend. Make sure to subscribe to the channel. And also, we are on Reddit and Discord. All that's down below. All our sponsors and everyone that supports us down below there too, so you can get whatever you like from us. All right, peace.